Hi, I'm Dr. Archer Crosley. Welcome to Real World Pediatrics. So today I wanted to talk about the DPT vaccine and its relation to allergy and asthma. Okay, in their book, Vax on Vax, Let the Science Speak, Robert Kennedy Jr. and Brian Hooker discuss the DPT vaccine. Now, in this particular chapter, they go over a hodgepodge of studies. I'm going to do several videos as I try to take these apart one at a time. Now, this might be a little boring, but I think it will be worthwhile. And the video won't take that long. So let's begin with a study written by Tricia McKeever, PhD et al., which comes out of the United Kingdom. It is entitled Vaccination and Allergic Disease, a Birth Cohort Study. So the study looked at about 29,000 children ages 0 to 11 years that had slightly more males than females. Okay, cohort study, that is a type of observational study that follows a group of people who share a common characteristic or exposure over time. In this case, the administration or lack of administration of vaccines. So researchers watch this group to see how many develop a specific outcome or disease. Now, cohort studies can be either prospective, following the group into the future, or retrospective, looking back at past data. So we can go back to 1980. We can say, let's look at the newborns from 1980 and let's follow them forward 20 to 30 years. So here are some of the findings verbatim. In this observational study analyzing computerized primary care records, we found an association between MMR and DPT vaccination and the incidence of asthma and eczema, but these associations appear to be limited to the minority of children who rarely seek care from a general practitioner. This limited association is more likely to be the result of bias than a biological effect. And as a kicker, they note, there was no relation between the age at first injection of either DPT or MMR and the risk of asthma or eczema. The total number of vaccines given also showed no association with the incidence of allergic disease. That's important because anti-vaxxers are always talking about when the first vaccine was given or the total number of vaccines that are given as it relates to perhaps an increased incidence of allergies, asthma, autism, or other maladies. Okay, now, I've read parts of the original study, which you can find online. This study is not written clearly for people like me. Now, perhaps mathematicians and statisticians will understand clearly what she's trying to communicate, but quite frankly, I'm a little confused. On the one hand, she seems to say that the undervaccinated enjoy a higher association of allergies and asthma, but then on the other hand, she implies the opposite. Nevertheless, Kennedy and Hooker used the study for the parts they want, which is to demonstrate a connection between DPT and increased incidence of asthma and allergies. But then in a very clever sleight of hand, Kennedy and Hooker switch gears and allude to a study done by Jason M. Glanz and colleagues examining patients in the US. Now, according to Kennedy and Hooker, this study shows that the undervaccinated visit the doctor only 10% of the time fewer than the vaccinated. So here's their text verbatim from Vax on Vax, Let the Science Speak. I'll put it up on the screen there. I'm not going to read it, but you can read it as I comment. Now, what this means, according to them, is that McKeever's conclusions are wrong with regard to this positive association being explained away by lower visitation rates by the vaccinated. What Kennedy and Hooker are saying is, yes, there is a positive association between vaccines and allergic diseases and asthma, but it can't be explained away by the differences in visitation frequency because we have this study here in the US that says that the undervaccinated only visit the doctor 10% less often. So in other words, Kennedy and Hooker want to cherry pick the data in the worst way. They want to take McKeever's data, but not the conclusions. And to do so, they will conflate or merge the two studies to get what they want. And what I say to that is, veto, baby, life doesn't work that way. What Kennedy and Hooker are doing is unacceptable, at least to me. Now here are McKeever's conclusions verbatim. This is important. In summary, although our results in an observational cohort study demonstrated a positive association between vaccination and allergic disease, this association can be explained by ascertainment bias. These data, together with other published evidence, suggest that current vaccination practices do not have an adverse effect on the incidence of allergic disease. Now, there it is, my friend. It is what it is. Kennedy and Hooker are being disingenuous here. You can't take a study from the US and glom it onto a study from the United Kingdom. These are two different populations and two different healthcare systems. One would have to get into the nitty-gritty of the population in the United Kingdom to make a better analysis. This is apparently what the authors did. They are from the United Kingdom. Thank you.